Statistics, outcomes, volumes, survival rates. These numbers may seem overwhelming at first, but they can help you choose the best place for your child's care. To understand what they mean, a good place to start is by looking at how often a procedure is done. Studies show the more you do something, the better you are at it, just like a sport or musical instrument. Patient volume tells you how many children with a particular diagnosis we see each year.
It's sometimes hard for a family to come in a big hospital and meet lots of doctors and lots of everybody. It seems overwhelming. But in fact, if you have higher volumes, you need more doctors, but you also are more likely to have doctors who have specific expertise in that type of cancer. And you have surgeons who are more skilled and more have more experience in doing these very complicated surgeries. And if you see a diagnosis that requires a very in-depth and intricate surgery only once every 3 years, the best surgeon in the world is going to have a hard time maintaining that skill set. And so volumes allow our faculty to stay attuned to what's the newest treatments, stay attuned to our skill set that we need to care for patients, and all of our providers, even in supportive care, to understand how to better treat patients.
Numbers reflect the experience and expertise of not just one doctor or surgeon, but an entire team. Let's talk about outcomes. Outcomes show how children we treated responded to the care we provided. For serious diseases or conditions, the outcomes are shown as survival rates over a period of time.
And generally, when patients are looking at literature and survival, there's 2, 3, 4 types of survival that they'll hear or read. One is overall survival. That means at whatever time period they say, 3 years, 5 years, 10 years, it's how many children from the time they were diagnosed with this particular diagnosis are surviving. It doesn't tell you whether that child has had a recurrence, where their tumor went away and then grew back. It doesn't tell you whether there's been a terrible second malignancy that has occurred. It just says, is that child still living? What parents will also read about is something called event-free survival or progression-free survival. And what those numbers are generally less than the numbers for overall survival. And those tell you how many patients at that time frame never had their cancer come back. So it's a little bit different, and families sometimes get confused by that.
While survival rates are obviously key, outcomes are also about thriving. Gathering, analyzing, and sharing statistics help us constantly improve so your child can have the highest quality of life beyond treatment. When choosing a team to help your child through a procedure or treatment, numbers matter, but they're only a starting point. Interview providers, ask questions, trust your instincts, and then know you're making the best decision for you and your child. The statistics tell us where to look for improvement, but each child is unique. We see and treat your child as an individual, not a number.